I am Megan Wood, and I'm from Dallas, Texas.
Great. Who's your mentor in hand surgery?
Well, I've been lucky to have lots of them. I would say probably David Green, who was he was kind of in the retiring ages of his career when I did my fellowship down in San Antonio. And I still see him quite a bit at all the meetings and keep in touch. And then, of course, that more locally, when I came back and I started practicing, I am really close with Kim Mesra, who is now my partner, which is great. So to have her go from staff to partner has been really exciting transition, to become equals with someone who maybe isn't is always a really unique and great sort of career.
How about a recent difficult case or challenging case?
Well, there's always interesting instrument failures, So I think I was fixing a scaphoid and a drill bit broke off on a cannulated screw halfway through, and that was always a challenge. Like, okay, you've got to get out of this, and ended up fixing it. I think at this point in my career, it's the cases aren't as challenging as sometimes the people and the psychology. And that is really, the day-to-day and getting through the clinic and while still making, the patients feel good and the staff and yourself and everything. I feel like that is more the challenging at this point in my career rather than as much of the case.
What do you know now that you didn't know in the beginning of your career?
Well, I think what I would say now is what I've really learned in, practicing and in my career is, I was actually thinking about this early on. I think it's really easy to be very self-assured and self-confident early on, and you're sort of forced to be that way in the way training comes out. But then the longer you practice to realize how little you actually know, sort of all these things that we're taught and we feel so confident in them. And I feel now, our understanding, patients ask me questions. Well, why do I have arthritis, osteoarthritis? It's like, well, we don't really know. There's not a gene for that, that sort of thing. And then it's and as you think about all these things, I think that's sort of where I am at this point in my career. Like, there's so many things we don't know. Like, why do some patients Dupuytren's do great and others do terribly? Can't explain it.